Now, I want to take you to the Central Region where correspondent Richard Kojonyako has been monitoring events at the Winneba Trauma and Specialist Hospital, where about 45 nurses have been asked to go home and self-isolate pending the outcome of their COVID-19 results. Richard Kojonyako joins me on Zoom. Hello, Richard.
Hi, Gifty.
Richard, so what is there to report on the back of this? 45 nurses asked to stay at home when the cases, the number of cases is rising.
Well, so at the moment, 2 units of the Trauma and Specialist Hospital here at Winneba have been closed down. This is because they received a man who is a COVID-19 patient, but until that time that they tested, the test result came out, they didn't know, and there was no holding bay at the hospital, we are told. The hospital has been designated as a COVID-19 treatment center by the Regional Health Directorate. And so the man used the Accident and Emergency Center and a male ward until the test result came that proved positive. And so the man has been sent to the treatment center, but all the health officials that attended to the man or who were exposed as a result of this have been asked to go home to self-isolate. But they have some concerns that they have families in the house, they also have associates, they go out. So telling them to self-isolate means that they should move from their family apartment and then go elsewhere. But it is not clear whether they have a place for them to keep them, for them to do the isolation until their test results come. Secondly, they also say that the test results, it takes a very long time for their results to come. So by the time the results are in, they might have also exposed other people and even exposed themselves. Some of them might not even be positive after all, but might expose themselves or expose other people as well. And so these are their concerns. But the Ghana Registered Nurses and Midwives Association is telling or is asking the health professionals to stay safe. And they have been complaining of the absence or inadequate PPEs. They say that the cloth mask is not helping matters, because before these people are given these masks, they might have been exposed or they might have encountered other people that come to the facility.
So as we speak, where are they? Are they at home? Have they found a place for them?
Well, so the directive is that they should go home to self-isolate. So no place has been found for them. And so that is what it is now. They are going to their respective houses, but they said they knew that they would have been taken elsewhere to do the isolation, knowing very well that they have families and other people that they would even come into contact with.
Richard, what sort of response do we have from people who live within this area and also from behind the scenes, even in the health authorities themselves?
Well, it runs through. I mean, you've been recounting the number of health officials that are in the Central Region that have been affected. At the Mfantsiman municipality, close to 40 health staff have tested positive for the virus. At the Cape Coast Teaching Hospital, close to 40. You go to Elmina, close to 30. You go to Erim, close to 20. You go to Mori, close to 20. And so the number of cases keeps going up, and it's really a huge concern for them. And if care is not taken, the entire health facilities in the region might be grounded as a result of this one, because when one of them is affected, then they would have to take steps to do contact tracing. And sometimes they even say that when their contacts are mentioned, because they know that if they ask such health officials to do self-isolation or to go to mandatory isolation, the entire facility or the unit would have to be closed down. Sometimes they allege that their test results are withheld or they unnecessarily delay. So by the time these results are in, then a lot of them might have succumbed to the virus already.
Very disturbing one there. Richard, thank you for that update. So I'll tell you where else there is there's a similar issue, where else the number of infected people just keeps rising. It's the Western region being considered or referred to now as the epicenter. Takoradi. We'll be getting to Ina Natalia Kwanza. Takoradi and Takwa, I should say. We'll be getting to Natalia Kwanza for her to give us more. But